Good afternoon, Dr. Bauer. It is our pleasure for you to join us today. Dr. Bauer, Ms. Lisa Bauer is the Associate Professor of Anesthesiology and Population Health Sciences at Duke University. And today we would like to discuss warning signs that one might experience either in the prenatal stage or the postpartum stage. And on that journey, what these warning signs might be in terms of impending complications. So we'd like to start the discussion with you describing for us what are some of the impending warning signs that an individual might experience while doing their prenatal stage or after they have given birth.
Thank you so much for the honor to speak here today. I'm going to share my screen because there are a number of resources that might be helpful for people to access so that they can see what the warning signs are. And so I do want to direct you to this website, which is saferbirth.org. And this is under the AIM cornerstones. And these are the urgent maternal warning signs. Now, these have been created by actually the Patient Safety Council, and that was a group of patients as well as family members who experienced or their loved one experienced a complication of pregnancy. And this was combined with physicians who are experts in the field to create a set of warning signs that people might learn to help them know when to seek care. And this has been translated into 28 languages. So this is a great resource to have available, but I just want to go through a few things here. There are, these are all of them here, but starting at the top, this headache that won't go away or gets worse over time, that's important during pregnancy or postpartum. And the nice thing about this resource is that you can click on it and get even more information about it, as well as this is what makes this worrisome, what this could be. So preeclampsia, a migraine, rarely a stroke, or other brain problems. So this is a really comprehensive resource that is helpful for people to have access to. So I just wanted to go through a few more of these here. So definitely a headache that won't go away or gets worse over time. Dizziness or fainting is really concerning because that could be an indication of being very dehydrated or having a heart rhythm problem or other heart problems. And the thoughts about hurting yourself or your baby, it's very common to have postpartum depression. And so knowing that that is a sign that you really need to seek care and to realize that there shouldn't be any stigma or shame in doing that. Getting that help is exactly what you need. And then also changes in your vision could be related to a number of health conditions: fever, trouble breathing, chest pain, severe belly pain, severe nausea and throwing up, vaginal bleeding during pregnancy, vaginal bleeding after pregnancy, swelling of your legs, extreme swelling of your hands and face, or overwhelming tiredness. Now, it's important to note that these are not everything that might be experienced. And so it's important to know your body and to know that if something doesn't feel right, to feel empowered to speak up and get the care that you need.
Thank you. I think it's very critical that we educate the population that while they're on the perinatal journey, that it's important to listen to their bodies, as you stated, and to advocate for themselves. So, what should a person do? How long should they experience these various symptoms before they should do something?
So this is if you are experiencing any of these symptoms, I would suggest that you reach out to your provider as soon as possible. And if you can't reach your provider because, let's say, it's on the weekend or if it's late at night, there's usually a number you can call for the on-call person. But if there's not, I would suggest that you go to the emergency room if you're experiencing these severe symptoms.
One of the things that we often hear is that I thought about it and I tried to tell my provider, and I'm not sure that they heard me. So let's chat a little bit about advocacy and self-advocacy, or having a partner to advocate for you. What has been your experience or your suggestion around advocacy of patients during the prenatal journey?
I have Um, I have heard that story many, many times. And so we're very concerned about it because we want all patients to feel heard and also to have the resources that they need. So I'm actually going to share another really helpful resource that to help people in their journey so that they can feel heard. And so let me go ahead and share that as well. And we can also provide this website link, if that is helpful. So we actually created, um, advocacy language and actions, and I'm gonna share the screen now. So this is a resource that was created by the work that we're doing to improve maternal sepsis care. So this was created by the Maternal Sepsis Community Leadership Board, which is composed of people that survived maternal sepsis, as well as community leaders, public health leaders, um, and people that are just invested in their communities and trying to improve care. And so these are some examples of things that patients can say if they're not getting the care that they need. And I do want to stress here that we're not saying that it is the patient's job to have to advocate for themselves, that that's their responsibility. That's not what we're saying. We're acknowledging that we know that bias occurs, and we know that many times patients can feel not heard, or sometimes people make a snap judgment about that patient is probably fine without asking more questions. And we want patients to feel like they can speak up and also be persistent in getting the care that they need. So some of these statements here are things that people can say when they're not feeling heard. So I'm very concerned and I don't feel I'm being heard. What are my next steps or alternative options? This is very different for me. I've never felt this way in my life for my benefit and my family's benefit. I should be seen. And so there's a number of things here that people can say because a lot of people just didn't know what to say when they weren't being listened to. The other thing that's important here is some advocacy action tips. So we heard from a number of people that they didn't realize that they could actually go to triage or the ER after talking to their physician's office, and they told them that they were fine and they didn't need to be seen. And this is letting people know that you can do that. You don't need someone's permission. You are the one inside your body and that you can seek care. And if you are at a hospital and you're not feeling heard, you're not getting the care that you need, that you can certainly go to another hospital to seek that care. And also, we talk about in here having another person to accompany you to help advocate for you. So, a support person, a friend, a family member, a doula, anyone that you think can help you. Also, bring a list of your concerns that you want to be addressed. Sometimes people pop in the room so quick that you don't remember everything that you wanted to ask and everything that you were concerned about. And those things are important. And then also that your concerns and feelings are valid, and be persistent in getting the answers or the care that you need. Your voice should be heard. You should get answers to your concerns.
You know, what you said is very key. And how do we work with providers so that they can be more in tune to listening to what clients or their patients are saying to them?
Well, we're all working on that, and we're doing a statewide campaign to provide these resources to patients, but also to work on listening to patients. And we also need to standardize our assessments when people have these types of concerns so that different people don't get different assessments. Standardization of care saves lives. And so we're working on distributing standardized assessments for physicians to adopt and modify for their practices. And so that is something that we all need to work on. And I do think that implicit bias training is extremely important so people can realize when these things are happening so that they can change them, because it has been shown that if people are aware, they can make change, and we can improve our care.
So on this topic, if we were to summarize and identify one or two very critical things that people should take away from this discussion, what would that be?
I think it would be to learn the signs. We know that because of really great public health campaigns about the signs of heart attacks and strokes has been very successful in patients seeking care very quickly. And there's no reason why we shouldn't do that for pregnant and postpartum patients. And so even if you're not pregnant or postpartum, you probably have a friend or family member who may be going through that. And it's important for you also to learn those signs, because many people seek care or they seek the advice of their friends and family when they're experiencing something first. And so it's really helpful if you can have these at your fingertips so that you can tell whoever's asking you that, you know what, I think this is really serious and I think you need to talk to your doctor, or you need to go to the ER if that's something they're not able to do. And so I think learning the signs is really important, but also realize that your concerns are important and that you can advocate for yourself and you can get the care that you need. And you should do all of those things for the safety and for the health of yourself and your loved ones.
Thank you so much, Dr. Bauer, for being willing to share this information. It is critical that we all participate in creating opportunities for healthy births. And so thank you again, and welcome to participating with us. And thank you again for participating with us in our newsletter for SEMPQIC.
Thank you so much. It's been a pleasure.